Well, I define anxiety as a future-oriented emotion that involves thoughts of uncontrollability and unpredictability of future events. We also call anxiety preparatory coping because anxiety at the core is meant to help you prepare for potential threat that might happen in the future.
So you don't have anxiety about things that have already happened, it's just the future things that you think are going to happen.
Right. So by definition, anxiety is always about the what ifs. If anxiety had words, it would say, well, Renee, I don't know if this event will happen again or not, but I have to be prepared just in case.
Uh-huh. And many people would say that could be very healthy because that helps you prepare, helps you do your best, that you just don't walk into situations unprepared. When does it cross the line of being something that you should really address?
It crosses the line when it becomes chronic and I experience what I call subjective distress. Like I'm personally bothered by the amount of anxiety that I have and or it impairs my functioning. So it messes things up with friendships, work, school performance, things like that. So when I reach a threshold where I can't sleep and I'm having difficulties adjusting to my environment, that's when anxiety's kind of cross the line and it could become a disorder at that point.
What
Right.
are the kind of anxieties, the lack of a better word, are young people age 8 to 22, college age, really facing the most?
Social anxiety is one of those really debilitating conditions. In fact, it's the third most common mental health condition, and 15 million Americans per year struggle with a social anxiety disorder. Any social situation you find yourself in has the potential of negative evaluation. I could find myself in a fast food drive-through, and though it's unlikely, someone could still, say, "Oh, look, he's in the drive-through," and make fun of me, so to speak. So with that said, as a youth, typically when I'm experiencing like trying to find my identity, when I'm navigating school and social relationships, certainly peer pressure, social media, all of these
Right.
things are new demands that young people have to face today. So therefore, there's a lot of actual pressure that they have to face. And if I'm sensitive to negative evaluation, then social anxiety certainly can be chronic and be a problem for many of the youth.
What are the treatment options for anxiety disorders?
Well, certainly medication is the first line treatment for many people who struggle with anxiety and related disorders, but the gold standard would be CBT or cognitive behavioral therapy. And the way cognitive behavioral therapy works in theory is that it essentially teaches you the importance of recognizing that your emotions have three parts, and that is your thoughts, what you think about, how you think about things, your feelings or physical arousal in your body, and your behavior. So that's kind of the basic cognitive model. And based on CBT, understanding that thoughts, feelings, and behaviors are what create the emotional experience in your response, helping people navigate various situations that are traumatic or stressful in nature through a very graduated process is part of how CBT works.
And you're using virtual reality in many of these instances, right? Is that a part of the CBT model or is that separate?
Yeah, so virtual reality is more of an innovative way to infuse the CBT model into various treatments of anxiety and related disorders. It's a novel approach, and obviously it's one that's really attractive for many people who want to have some innovative way to deal with symptoms that they may not otherwise manage, like
Right.
by seeing someone traditionally.
All
So
right.
here's the headset that I was telling you about.
Okay.
And you can adjust the focus of the headset based on eyesight and such. You just tell me when you're comfortable with that.
Okay.
Okay.
Yeah.
And
Everything looks pretty clear.
so the left toggle, Justin, that one, yeah, it's like you play games.
Right.
So the left toggle is how you're gonna move. Are you moving? You
Oh
see
yeah,
it?
I can
Okay.
move now.
All right. So the way this one works, Justin, is you're in a hotel lobby or an office building, and we can see what you see on my screen. The way virtual reality exposure works is that depending on the nature of their anxiety, typically it's going to be a phobia or some sort of social anxiety disorders. And PTSD also, virtual reality is very effective for that. But the way it works is that it's infused along with cognitive behavioral interventions as part of the treatment process.
Okay.
And it's extremely effective and research supports that. So there's an open elevator that I want you to walk in. You can see there's the glass of the elevator, and then we'll get him to go up to like the edge of the second floor.
So you actually put them in those situations that would prompt their anxiety.
Absolutely. So the way it works is that there's a component of CBT called exposure, and it's exposure to the anxiety itself. It's one of my mottos is that if you're afraid of elevators, at some point you have to stop talking about them.
Right.
So with that said, you gradually expose someone to the feared situation or event, and you're essentially engaging in a different type of emotional processing. So you have this memory established in your brain that elevators are a speech, are very scary, have had a negative experience, and what you're teaching them through the process of exposure is that you can learn a new non-threatening association in your brain through the exposure process. Virtual reality exposure is a way to facilitate that.
Is anxiety or anxiety-related disorders, are they inherited or genetic? Is there a genetic predisposition? If your mom was constantly, you just thought she was anxious, but it was really an anxiety-related disorder that was never really identified.
Yeah.
Is that an inherited thing?
That's a great question. In fact, that's the #1 FAQ that we typically get. And the way I answer that, Renee, is that children who have an anxious parent are about 3 to 7 times more likely than a child of a non-anxious parent to develop an anxiety disorder. That sounds extremely genetic, but what we know is that the majority of that transmission from parent to child anxiety is not at all genetics per se.
Right.
It's much more modeling and vicarious conditioning, so that information transmission that I have when I'm an anxious parent, I usually communicate threat to my children, right?
Right.
Who think about the world through the lens of parents or caregivers, and therefore that teaches me to be anxious unintentionally about various things in my environment.
So nurture versus nature, nurture over nature.
Yes.
In that situation.
Yes.
So just as it can be learned, it can be unlearned.
Absolutely.
When you hear a patient or a client say, you know, I just feel so alone when it comes to dealing with my anxiety or my phobia or my OCD, what do you say and what advice would you give?
Many people come to treatment and therapy saying that. And I remind them, you're in very, very, very good company. Anxiety is very treatable in a very time-limited way. And if you're motivated and adhere to the procedures therein, you most certainly can function the way you need to function.